We reconstruct the landscape of which mutational processes are active in multiple myeloma, and we go further and look at the timeline of this mutational process. And we notice that one mutational process is active every time from cancer development, and it's the same mutational process that is active in every cell, and it's called signature 5. It's just a classification name, but the idea is that it's constant over time in what we call the clock-like. It's like the associated with aging, an increase with our years. So a 10-year-old boy has in his body less mutations, signature 5, than a 90 years old. Using this ratio and some complex mathematical model, we estimate the mutation rate for each patient involved in the study. And once you know the mutation rate, you can understand when the first chromosomal alteration, in particular chromosomal gain, so a duplication, was acquired. And we date our estimates with a large interval of confidence, a certain grade of uncertainty, are approximately 40 years before the cancer diagnosis, usually before 30, and most of the case, in half of the case, before 20 years old.